Welcome to the Be Encouraged show. I'm Lisa.
And I'm Frank.
So we are diving today into real life conversations with two incredible women. Lauren Silk, a doula, leader, and advocate in the Beginnings Birth Center, doing amazing things with women, and Dr. Rachael Langley, also a family local physician and veteran, and founder of Homestead Direct Primary Care. So two voices, one message, empowering women. Please join us.
Can you imagine having your 7-minute conversation with your OB and actually getting into that? I mean, you bring a birth plan and they laugh and throw it in the trash so often. You don't get to actually say, well, what was wrong with that birth plan? Part of the reason why I became a doctor is because I had experiences as a child myself.
And what is the biggest challenge?
Creating my own business by far. I mean, doctors are always told, stay in your lane. Physicians need to just physician and don't worry about the business side.
Your first baby might take you, a good amount of time. We've never, gone down those pathways yet.
Yes.
But then to have a midwife on call for your second baby, be like, this looks nothing like my first one, and I think I need to come in. Yeah. And she says, absolutely.
Welcome to the Be Encouraged show, Colorado's voice for growth and good. I'm Frank.
I'm Lisa.
And we have KO Photography. The great Carrie Ann is here with us and a sponsor of the show. Photography is where storytelling meets fine art portraits. Now, whether you're building a brand, celebrating your family, or honoring the life of a beloved one, KO Photography creates meaningful artwork that lasts for generations. And I know, because you need to visit her at kophotography.com to learn more. And we left a flyer for you guys to check out as well. Take that home. What great photography she does, Lisa.
Yes, and today we are joined by two incredible women empowering other women through their journeys to make sure that they're seen and heard as well through pregnancy and birth journeys.
Oh my, really?
Yes.
Oh, gee. I'm looking at Dr. Rachael, the eyebrows. There we go. Yeah. Hey, guys, let us start here. We're so glad to have Dr. Rachael Langley and Lauren Silk. First time I've had an opportunity to meet this lovely lady.
Yes, very excited to be here.
Yeah, thank you both for being with us today. Rachael, we've known each other a while. Matter of fact, I do walk with the doctor with this young lady because she's trying to keep me on earth.
Thank you for that.
As long as possible.
She is so amazing. What is the biggest challenge that you've had to overcome in your journey so far?
Creating my own business by far. I mean, doctors are always told, stay in your lane. Physicians need to just physician and don't worry about the business side. And that's why we got into such a mess with all this insurance stuff.
Yes.
Is that we had these financial people running the business and the doctors taking care of patients, and we didn't quite line up in our priorities. And so now we've become separate entities, and that's just not the way it's supposed to be. As a business owner, we can make choices that really support our patients. I mean, when I have a patient that calls up and says, I can't afford care this month, I can say, guess what? Don't pay. Take a month off. Take 3 months off. Yeah. I can take care of you in the meantime, and you get through this hurdle. And being able to take care of them both financially and medically is so important.
Oh,
that's awesome. How about you, Lauren? What's been a big challenge?
So, in representing the birth center, we see challenges all the time. We are the only freestanding birth center in all of Colorado Springs.
Wow.
And so here we go up against those big giants a lot of the times. These labor and delivery units at hospital centers and those kinds of things, trying to offer something different and trying to give women the attention and be able to care for them and meet them where they are. And so I think we hit some of those same financial things. We do take insurances. We take all insurances and TRICARE and Medicaid and those kinds of things. Being able to work within that financial system, but being able to bring it away from the big hospital system.
Yes.
And I mean, every time you want to try and do something different, you're going to hit obstacles.
Yes.
Yeah, especially when you're up
Exactly.
against such big behemoths
Yeah.
like you guys are dealing with.
Right.
Lauren, you've been a nanny, you've been a
Yeah.
doula,
I have.
and now a leader at Beginnings Birth Center. What first drew you to serving families through pregnancy and birth?
I kind of hit that same note that a lot of doulas, midwives, those is finding those people for myself, for my own birth, right? I've had a little bit of everything. My birth journeys, I've had lots of them, 6 actually. And, yeah.
Bless you, ladies.
I've had 6 babies,
Yeah.
yes.
Wow.
And
I've only had 5.
I've had 5. Yeah, I didn't have
You
one.
didn't have to birth that.
She put her hand on the hip very quickly.
No. I'm always looking for the restroom because I'm like, you never birthed kids, so don't talk to me.
So I had a hospital journey for my first. I was under the care of a midwife, but a midwife that was under the thumb of a physician, so in the hospital setting.
Okay.
And it was, I think, what every woman thinks it's going to be when you go into that, where we got through that. But there were needs of other people at the same time, and there was lots going on, and, just ringing your call bell to see if somebody will answer and those kinds of things. And for the second journey for my son, who is now almost 12, I was like, there's got to be a better way to do this.
Yes.
Right? There's got to be, what else do you do here? And just went down the rabbit hole and found the word doula and found, the word midwife, and figured out how to have that kind of experience in my second time around. Fell in love with birth work, and I think once you're in it, you don't really get out of it.
Yeah.
Once you are able to walk alongside women when they go through that just life-changing, emotional changing, just this blossom of things, you get a little addicted to that. And so I did
love
doula
that.
work for 10 years, being able to walk alongside women, and I've been able to witness over 400 births.
Oh, my.
Thank you. That is a service. Seriously.
And, as my kids grew and got older, and I'm like, I don't want to be on call anymore.
Right. Yeah.
So I stepped into the business side of it and was offered this opportunity alongside Jolene Hammond, who is the founding midwife of Beginnings Birth Center, and even have her say, I see things in you that you don't see yet. On
so
this
great.
That's true leadership, isn't
marketing
it?
and this outreach side. And I was, when they offered that to me, I was 9 months pregnant, and I was
wow.
like, you want to offer me a promotion while I'm about to go on maternity leave? That's unheard of, right? So step back into this and just have been taking it as far as I can take it.
Wow.
Oh, that's such a wonderful journey.
So, Dr. Rachael, first of all, thank you for your service. I mean,
Yes.
Thank you for your
real.
support.
Colonel Langley.
Yeah. Yeah, let's go.
She says,
So you started out as a teacher
I did.
and then became a family physician.
I did.
Right?
Yeah.
And then you decided to run your own direct primary care.
Absolutely.
So what inspired you to make your patient's choice, that's a different model, right? They
Yeah.
choose to come to you.
Right. I have to advertise. What is that?
Yeah, right. So what inspired you to make a patient choice such a core part of your work?
I mean, part of the reason why I became a doctor is because I had experiences as a child myself with getting a bad burn on my arm and looking around at the way these doctors were treating me and realizing as I grew up and reflected on these experiences, I could do better than that. Why were these doctors saying these weird things to a child? They just had no idea how to interact with a child. So I wanted to do it better. And so I became a family physician, and I was always looking for ways to do it better. And so I became a flight surgeon because I saw that honestly, they had less time in clinic and more time interacting with their patients outside of the clinic. So with pilots and air traffic controllers, they got to visit with them at their places of work and make sure their places of work were safe and accommodating, and then interact with their families too. So when I was offering that level of health care to these pilots in the Air Force and their families, I didn't want to change that when I got out. I wanted to continue to offer that level of health care to everyone who came into my life. So that's what ended up being direct primary care, is being able to offer that one-on-one relationship-based care where they can just text me and call me, and I can send out UTI antibiotics on the weekends because that's what's best for them.
Yeah.
And it's so much easier than calling up your doctor and waiting till Monday and waiting for the phone call and the phone tree. And then maybe you have to come in, maybe you don't. And you just have to give a urine test. Just trust the woman's symptoms. That's what research shows, is just treat the UTI symptoms when they have symptoms.
Yes.
And lots of things like that in medicine that it's become much more of a process than it needs to be. And I can offer the health care that I want to.
Well, thank you for making that choice.
Yeah, and listen to the passion that she was saying that with as well.
Yes.
You know, and I'm a little biased because I love you, right? And
She's pretty incredible. I've known her for years.
And she's my very, very good friend, and I have opportunity to get to know you. And I was an Air Force guy as well.
I was a key spouse for 10 years too.
Yeah, she was, right? So in both the Air Force and medicine, Rachel, you've faced high pressure environments. What's been the toughest challenge in advocating for women's choices in healthcare, given your journey?
Ooh.
I'm glad you got it.
You said the toughest part of it, or the
toughest challenge in advocating for women's choices in healthcare, given the journey that you've been on.
Yeah, realizing that you really do need to slow down for a minute. It can be so easy to get caught up in the fast pace and getting this done right now. But so often, I mean, in medicine, we say the first step in CPR is to take your own pulse.
Yes.
To sit back, breathe, look at the situation, and really see that you don't have to jump in and have an answer right away. Sometimes the answer is to go back to the books, to go back to your colleagues, to go and talk with someone about your other options rather than to jump into the first thing that seems like the right way to go. So to take the pressure off of yourself. I mean, I was offered this opportunity through Beginnings to, I've been a breastfeeding counselor for a long time, and I'm an IBCLC because I love supporting women in that way too. So that means
A what?
a lactation consultant. Because
Which I appreciate that. I had to have that service in the hospital, and I love you
everyone
guys.
should.
Yes, it's a great thing.
I had such a hard time with my first, and so I had to get that certification just for my own peace of mind to be able to offer that to my patients. So, I mean, that's an example of, instead of just jumping with antibiotics or a referral or something like that, instead I can rely on that training of a lactation consultant with my patients and talk them through their breastfeeding journeys, their breastfeeding difficulties. And then after I delivered my last baby with Beginnings, I talked with them more and more. I kept being, I was obviously impressed enough.
You delivered your last baby?
I delivered my last baby with them. They were so good.
And then we were like, wait, we give women choices and you give women choices?
Yeah.
This has to be our doctor
Let's
recommendation.
collaborate.
So good. Oh. And I moved here, I looked into my options, and I was blown away by Beginnings, both recognizing women's choices and the experience of giving birth being important beyond just get the baby out safely, get mom through it safely, whoop-de-doo, yeah, that's all we need to do. It's so much more than that. And I loved that they're right down the street from a hospital. I heard about women being transferred because I don't want to hear that they're never transferring patients if they're above their level of care.
Right.
So that's reassuring to me that they are taking the time to acknowledge they're stepping back and saying, this might be too much for us for the safety of mom and baby. Even though we really wish we could deliver them, they really need to go somewhere else.
Yes, yep. That's good.
So, that just inspired me so much. So much that I delivered there, and then I continued to want to find ways to work with them They had a midwife at the time who came to my house 2 days postpartum. I mean, that's the exact time when you do not want to leave the house and you're supposed to go in and have these tests and exams. And instead she came to me and offered that to me. It was life-changing. It was so wonderful not to leave the house. So now that midwife had to move on, and I've taken over that program instead. So for women that have given birth at beginnings or have gotten care at beginnings, I can come to their house postpartum and just take care of them there and leave them in their own beds and don't worry about the mess. And I know everything's a disaster. I've been there 5 times. It's okay.
Postpartum's actually going well if everything's a mess, because that means all that you're doing is snuggling your baby.
Exactly.
Don't do the other stuff. Just snuggle the baby.
That's new beginnings, ladies.
So, Lauren, as a doula and birth center leader, which has been some of the biggest barriers for women to give them a voice in their birth experience?
I mean, be open and honest with you. It's getting into that rut of you, like in our systems of this is how we want to have babies. We want to control how we have babies. We want to plug you into the machines, and we want to hear the beeping if something goes wrong. And the lack of just choice in that of like, just get in line and do as we say, and we'll get you through this, and then go home and we'll see you in 6 weeks, right? I think really the biggest challenge is being able to have women, serving women in a midwifery role, so that if they want to have an unmedicated birth, if they want to have a medicated birth, if they want to be in certain positions, if they want to be able to walk around while they're doing all of these things, that they have the choice to do that. And here in Colorado Springs, they don't have the choice to do that within the hospital systems. We do not have any midwives in our OBGYN offices and our labor and delivery.
Why?
That's a really hard question, right? Our midwives are allowed to practice autonomously, which means they don't need oversight by somebody else. So they can practice within the hospital systems and within their own practices and go through for all of those reasons and prescribe and do that, all of the things. They can't do surgery. They're not trained in that. But practicing within the hospital, they can absolutely do. And that is a model that we see nationwide, but we don't see here in Colorado Springs. And that has to do with a lot of upper level management type decisions. And we see shut doors for that.
Is
right
that because
now.
they're 1099ers maybe?
No, not at all. No, we take insurance and we are accredited and all of those kinds of same things that doctors, we have malpractice insurance, all of that. It is not the level of practice that is the worrying thing. It is within the written rules and CEOs and C-suites that say you have to have a physician sign for you in our facility.
Okay.
And then we don't see those physicians reaching out that hand to say that we would like you alongside us in our practices.
Interesting.
Yeah.
They don't want to bridge that. So those
Makes no sense to me.
Yeah.
So those are the hard things right now. That's the hard things is women deserve midwifery care on all spectrums.
Yeah.
And we can't give it to them right now.
And they don't know about it.
Right.
A lot of them probably are just innocently not knowing, so they just do what they're told, like you said.
Yes.
Come in, see the doctor, and then...
Number one thing I hear, I didn't know you guys existed.
Yeah.
From moms, right, that are first that are going to be grandmas. The first thing of I wish I had this when I was having babies, right?
Exactly.
I just went to the hospital, and a lot of times they were like, I think you're safest at the hospital. But really, when we take a step back and we take the pulse of that and we really look at where some of those high-risk situations are coming from, the statistics at Beginnings Birth Center will knock your socks off.
Yeah.
Right? Absolutely. We have an under 10% C-section rate, okay? And here in Colorado Springs, women almost have a 1 in 3 chance of having a C-section.
Yeah.
1 in 3.
Yes.
I
Just by
believe
walking
that.
through the double doors.
Yeah.
27% in some of the hospitals here.
I gotta say, with my daughter Kayla, who was 2.5 weeks late, by the way, I did the whole, water broke, go to the hospital, plug me in. They completely forgot about me overnight. Like literally, I thought they were monitoring me, all the things. Then the morning shift doctor comes in and goes, how long has she been like this? Okay. And then they went C-section now.
Oh, yeah.
So had they been working with me through the evening and all that, you
You
know,
might
it
have
was...
been able to have her next.
Yes.
Yes.
Exactly.
Yes.
Oh, my.
Right.
Yes.
Wow.
When we take a look and we look at the spectrum of what is normal labor,
Yep.
Yeah.
right? It's a pretty large spectrum. It doesn't
Yeah.
just like,
yeah.
you know, you better have your baby by this,
Yeah.
by at
Right.
40 weeks, you know.
Exactly.
We
First
actually,
baby to sixth baby, what
Yeah.
a difference.
oh my gosh, your first baby might take you, you know, a good amount of time. You know,
yeah.
we've never, you know, gone down those pathways yet.
Yes.
You know, but then to have a midwife on call for your second baby, be like, this looks nothing like my first one, and I think I need to come in. And she says, absolutely, I'm going to meet you there, and I'm going to be with you through the night, and let's see what we can do for this
So
labor.
good. So
right?
good.
So.
Wow. Wow. You're not excited about this.
My shirt says talk birthy to me.
I love
could
it.
do this forever. I could do this forever. You know, like I'm so lucky to be able to keep my passion and like then be able to talk to people like you.
Absolutely.
And sleep all night. That's
And sleep all night.
Not having to go
I
in
do get to sleep all
for
night.
the
right
middle
now.
of the night.
Thank you. Sleep all day. You know, Lauren, birth is deeply personal,
Yes.
but it's also community driven. So, how has beginning Birth Center created a culture where women feel supported and empowered?
Bring it back to the village. Man, bring it back to the village. You know, we have been having these conversations within our staff lately of when you were pregnant and going to be giving birth, you were surrounded by other women who had done that. Your sisters, your aunties, your mothers, and they would surround you and they would be able to tell you what's normal in your body and what's not normal in your body.
Yes.
And they would be able to have the experiences like you just shared with me of my water broke, but labor didn't start for several hours. So this is still okay. We're still okay in this. Even with the breastfeeding that you talked about, right? That you've now taken on that part of the village of being able to show a woman how to breastfeed.
Yes.
When we used to have the ability to even feed a baby if
Right.
somebody was having damage to that system and feed each other's baby and those kinds of things. Now we're not feeding other babies for people.
Right.
But we've introduced this culture back into the space that you can have open conversations with us. We're going to be able to tell you what's normal and not normal. You're going to be able to reach out with a text message and tell us you're scared, and we're going to take care of that right away. We're going to be able to give you human donor milk if your baby's not feeding correctly through Mother's Milk Bank that comes from Denver.
So great. So
Yes.
good.
So we can make sure that we're filling those roles that the village used to give and bring back that sense of community that we're missing through just like maybe read a What to Expect book.
Exactly. That's the only book I have.
It's the only book you had, right? And bring it back and take some of the fear out of it. I made him chuckle.
And it's
You probably had that book.
I did
Yep.
have that.
Yeah.
There's
book.
so many.
Yeah,
There's
yeah.
just nonstop support groups at
Yeah.
Beginnings Birth Center too.
Yes.
I mean, the breastfeeding and early parenting, and I grew up with Low Leche League for my first, and that was so good just to see other moms nursing their babies
Yes.
and to
Yeah.
hear what issues they were having, and me to okay, this is common that toddlers have this issue, and that's okay if my toddler has this issue
Exactly.
in the future.
You should hear our front room family room where people are greeted, right? And like, oh, when are you due? My back has hurt so much. Does your back hurt? And all
Yeah.
of these kinds of things. Oh, you've gone over. You're still okay. You're still feeling good. Yeah, I'm good. You know, I'm gonna come see them next week, and we're gonna get this baby. But they have that back, right, to talk about the normalcy of all the things that they can expect.
So good.
Wow.
Okay, Rachel. So having launched and being in the thick of direct primary care, how do you see the direct primary care evidence-based care changing the conversation around women's health choices?
I mean, just being able to have the conversation. You don't have time to talk about any choices, about your birth desires. Can you imagine having your 7-minute conversation with your OB and actually getting into that? I mean, you bring a birth plan and they laugh and throw it in the trash so often. You don't get to actually say, well, what was wrong with that birth plan? What is, I've never done this before. Can you tell me what what is normal, what is not normal. I haven't had anyone in my life who's given birth before. I need to find this out. No one will talk about this with me, and I thought my OB was supposed to have this conversation. But I mean, I find often with people that are seeing OBs, I love OBs, they do great things, but they're often in the system and being weighed down by all the pressures they have from insurance company.
Right?
Right.
Like 10 minutes on average with a patient.
Right. Oh, so I love my patients, whether they're seeing beginnings or seeing an OB, I can still find the time to have that conversation with them about, well, maybe if you voice your concerns to your OB like this. Let me tell you the secret medical lingo that'll get into their head and help them to understand your concerns. Or, tell me all about your worries about what this could happen or this could happen. Tell me about, episiotomy, you've heard of that. Let me tell you what that actually is and why you're not going to get one of those.
Yes.
Not exactly.
And how much evidence there is against those being commonly used. So I think it really comes down to the time that I can spend with my patients, is that gives them the opportunity to bring up their concerns and fears and have them be heard and understood and feel that acceptance.
Love that.
Wow, Rach. Wow. But this conversation is kind of off the chain.
It's great.
Right?
Yes.
Yeah, we say that.
We want things to change. We want things to change. And I know Rachel well enough, she's known me well enough, we're not scared.
Yeah, we're definitely not scared.
No.
So, yeah, we're all children bearers in the room today, you know.
Yeah.
We have babies and have 13 grandchildren.
Awesome.
I know.
Yes.
My kids got the memo. Only reason we had them were to have them.
Right.
Right, so Rachel, you know, for a woman listening who feels like her voice isn't being heard by a provider, what's the first step she can take towards reclaiming her choices?
Maybe, evaluating whether a direct primary care might be an option. It's such an area of healthcare that's booming right now. I was just at a conference in Denver for Health Rosetta as well as Hint Health we're talking about mostly to insurance providers. That's what Rosetta Health does. Mm-hmm. And they're learning more about direct primary care so that they can offer it to employers to offer to their employees. So it's not just a one-on-one kind of deal anymore. More and more employers are seeing this is such an easy thing to offer to their employees that will just blow their expectations out of the water. Mm-hmm. They'll be so surprised at the degree of health care that they're getting, and then they'll apply that to their employer and be like, oh, my employer really cares about me. Who knew? So looking into...
Well, and it helps the mental health too, right?
Right. Yeah. I mean, the level of anxiety just comes down so much when you feel like when you realize you're being heard, when your concerns are expressed. So whether, I would say direct primary care is the answer. I mean, that's the way that you get heard. And I mean, not even every direct primary care is going to be right for you. Right. There's numbers growing every day across the nation of direct primary care clinics opening up. So just because one doesn't fit you doesn't mean that they're all not going to be quite right. I love it when they try a couple, have a meet and greet with me for free, meet with someone else, see who they really feel like they can communicate with.
Absolutely.
Listen to your gut about if you feel like you're being listened to, that's a good sign.
Yeah. You know, Homestead Direct Primary Care is a very good choice. We thought we'd throw that in for free. Right?
So, Lauren,
Yes.
Okay, there are families out there that might be a little nervous about stepping into your building,
Yes.
right?
Yes.
It's totally out of the box.
Yes.
So, how can you change their mindset to not feel nervous, to actually give you guys a try?
Yes.
Talk to that nervous piece.
Talk to that nervous piece. It comes out a lot, right? And sometimes they think, well, maybe we just want to have a hospital birth the first time, just to make sure everything goes okay, right? And then we get that situation coming back to us of like, we did not enjoy that experience. We can't wait to have the experience at beginnings because we know it's different. And then you have the first-time families that they are so excited. They have been trying for this baby, and they have done their research. And so that's what I invite people to do. either come see us. I will walk you through a tour anytime. We do a video tour online that answers many questions, and our statistics are published on our page.
Yes.
Right? So
Hallelujah.
absolutely. Our statistics are published on our page. You will know how many women delivered vaginally in our, how many women used the tub and all of the aromatherapy and all of the bed that will move and the ability to move your body, and the water births, how many babies were born in the water, in our big bathtubs. And so if you have questions, I would invite them to go online and watch that video. Come see me at Beginnings and get a tour, so that I can show you what this looks like compared to what that OBGYN office is going to look like.
Awesome.
Right? Walking you through the fact that we're going to spend at least 30 minutes with you at an appointment, not 7.
Nice.
And that kind of stuff. So
You get 23 minutes.
Oh,
23 minutes more.
Bonus. Absolutely more. And we walk the clinic side and they're like, okay, this feels kind of homey. I love the front room and I can get coffee and tea. And then we walk over to that birth center side and they see those beautiful suites, and they also see our medicinal like abilities to be able to conquer and treat those things that come up in labor and delivery, and how safe this is. And we talk about all of the training our midwives go through and all of our staff and the things we do on the pediatric side, the newborn side, and they go, wow, that's a lot more care than I thought I could get.
Oh, yeah.
And so then they feel safe because they know we know how to manage everything from the absolutely normal all the way up through some of those scary things that can happen to us. We know how to manage that. We know how to reach out and get extra help if we need it.
Wonderful.
Yeah. How long have you been at Beginnings?
4 years.
4 years now.
Yes.
They are blessed to have you.
Yes, they
Goodness.
are. Yeah. You're smooth as silk.
Yeah. She's on fire. Like, she knows her stuff.
I do.
And it happens to be your name, so hey.
It's like the business.
I mean, Frank, what I'm hearing from Lauren and Dr. Langley is truly your passion for helping women with out-of-the-box thinking and actions that they can take to empower them. I think it's incredible.
It is incredible. You know, my takeaway today from listening to both you ladies is there's a new paradigm. There's a new sheriff in town.
Oh, yeah.
Right, there is. And, you know, they are here to change the way that this process is thought about, managed, and done. Right?
Absolutely.
And it's so encouraging to me because none of my kids we did a traditional all the way, you know, and it had needles in the back.
Oh, yeah, me
the,
too.
What those clipping things, what do you call it, episiotomy?
Episiotomy.
Yeah, all of those things and et cetera, right?
Yeah.
And didn't know any better.
Yeah,
Right.
didn't know any
So we
better.
knew. I was born in a grocery store.
Wow.
Really?
Yeah, in North Carolina. Yeah, you would call it like a 7-Eleven today, like a.
Oh, you're a
a
7-Eleven baby?
Like a little country grocery
Yes.
store.
Usually
My
that means it was
aunt
a really
was
good birth.
my.
I was going to say, if it happens quick like that, then everybody's happy and healthy.
Yeah.
That's
my
why your
great
mom
aunt
had
was
so
my
many.
that person midwife.
Yeah.
Okay, nice.
Making sure everything came along okay.
Yeah,
Oh, cool.
yeah. So none of those things for me, and some people don't think I'm okay, but for the most part, I'm okay.
He's pretty okay.
We like him.
Great takeaways, guys.
Yes.
You know, this part of it is closing down because, you know what? You guys gave such incredible information. I can't wait for people to engage.
I know, it's going to be amazing. Yes.
You know, Lauren, I'm curious about Beginnings Birth Center. Give us a little history of start. Summarize the history, where it came from, etc.
Yeah.
How people can reach you there, and all of those good things.
Absolutely. She's getting these little stories. So, I mean, this started with a dream to bring something different to Colorado Springs. Jolene Hammond moved here. She served our country. She got her nursing degree through serving for our country. She practiced in Illinois, had the opportunity to come here in Colorado Springs, and worked in an OBGYN office where she saw that breakdown of women aren't getting the care that they need, right? So she took that step back and she was like, time out. I can't continue to push forward with the way that they're treating people, and I need to do this differently. So she went into some home birth practice while she got, all of her ducks in a row to open her own business. Rachel knows it's a big step, it's a big thing, and they broke ground in, Beginnings became what it is in 2018.
2018.
Yep, in 2018, and then welcomed their first human into the world in 2019. And have been serving the community for lots of women through there. We do between 20 and 30 births a month right now. And so open our doors to that. You can get a hold of us by going to beginningsbirthcenter.com, calling the front desk. It's absolutely the number you find on Google. You can even text that number because we are very savvy of being able to. You know what, you guys, our patients can reach us whenever they need to.
It's so
What a novel idea.
Like I said, and anybody's very encouraged to stop by and come look at the center. Whether you're expecting, planning to be expecting, or you hear this and you're part of the community and you're like, wait, what is this about? What are they doing? They actually deliver babies in this space. Yeah. Come see us. Come look at what we're doing, and you're going to go, aha, I get it now. Okay. Yeah. We are off of Briargate, just down the street from Memorial North Hospital. Okay. That's one of the staples in the community that people can usually find us. Yeah. And so we're tucked back behind a 7-Eleven.
Oh, I know exactly.
Don't stop at the 7-Eleven.
Yes, there is. Right there. Very convenient off of I-25 to find us. Awesome. And we have our doors open all the time.
The story that really inspired me when I heard about the birth center and the planning that went into it, especially as I was considering opening my business years later, was Jolene even went into the details of, no, we don't need just one water tank for hot water. What if we have 4 women in all wanting to give birth with a water birth right then? We need hot water right then.
Nice.
For my 3rd baby, I went to the hospital because they said they had a tub and the hot water was out that day. So my very kind nurse offered to microwave a bowl at a time.
Aww.
Wasn't going to happen. So I just said no because the water was icy. This was not happening. So that story just really spoke to me as to how much thought went into just how they wanted this to be. You walk in and it has such a beautiful mix of clinical, it feels professional, you don't feel like you're in a back alley or someone's back basement delivering your baby. It's a beautiful professional environment that's also comfortable and home-like.
So, Dr. Rachael, we would like you to also share your business and how they can reach you.
I started Homestead Direct Primary Care back in 2023, and it's located up north at Baptist and Glen Eagle. I started it because, again, I just wanted to offer my kind of medical care and was not wanting to have other people make up the rules for me. And it's been so much fun. I mean, little things like, I really like that wall to be yellow. Yes. And it is. And I love that wall is yellow. So silly little things to the bigger things that really matter, like being able to give free care to people who are struggling. I just love being in control of all of that and having both my heart as a physician and also my newly formed heart as a businesswoman being able to come together in my clinic.
Yeah. And I've had a great opportunity to walk with you through some of those things, and it has been a trip. Yeah. But you are a good trip.
Been there the whole way.
We took a trip and never left the yard, right?
Oh my goodness. Well, now's our favorite time, Frank.
Is it?
Yes.
All right, start us then, Lisa.
Okay, so as you know, our whole mission is to infuse hope and encouragement to the world. So, Lauren, I'm going to start with you.
Okay.
I would like you to look at that camera and encourage the world, please.
Encourage the world.
The world.
The whole world. I encourage the world to think outside the box. I encourage you to take your thoughts, as beautiful as they are, and how you want to be treated, and apply that to your entire life. You do not have to stay within the system. There is support for you outside of the system. And it's so enthralling and so encouraging to be surrounded by other people that have the same mindset as you, and it's out there and you don't have to stand in line for it. You can just step out of the line and find your new home. I encourage you to follow and be treated the way that you want to be treated.
Awesome.
Right on.
That was a good one.
Your turn.
Man. I would add on to that, speaking to the world, that you should also take that risky step of finding a community to talk to. Sometimes you might have to try a couple places, whether that looks like support groups, as scary as that sounds. You really need support? I did. I have many times in my life. We all need to find a group, a community that's going to be there for us, whether that's going to church, whether that's trying a new volunteer group, whether that's coming and walking with someone new at the park. Go and find your community that you can be with that supports you in being the person that you want to be.
Awesome. Thank you, ladies.
Thanks for having us.
We're sponsored by Brandon Kirk from Planet Duck.
Yes, he's the owner of Planet Duct, and he has the largest vacuums, strongest vacuums. And what is his slogan again, Frank?
Yeah, they're stronger than the vacuum of space. And Brandon and his family, with his 3 children, are just incredible. I know them personally. We've had a great opportunity to know them. He's a great family man. 25 years, been married to, what is his wife's name? Gaba?
And she's a beautiful artist, and yes, they have an amazing farm as well. But he loves the Colorado Springs. His give back throughout all local businesses in town is amazing, and we sure do appreciate him in town.
And one last thing, many of you didn't know this, but Brandon has mentored many small business people in this community.
Yes.
His give back to our community is exceptional. So they really are.
Stronger than the vacuum of space.
Look up Planet Duck.
So that's it for the Be Encouraged show today. Be sure to follow us on YouTube and LinkedIn and join us in the conversation at beencouraged.net.
Indeed. Remember, we have real talk, real growth, because we are real Colorado. Be
Stay encouraged.
Yes.